special interest in endocrinology and diabetes, and I'm just going to have a quick run through and talk about puberty and growth. So I think from the point of view of what happens in schools, I fully appreciate the fact that there are children right from a very young age and progressing through to teenagers. And there can be a variety of different issues which may come up and be noticeable to school teachers to do with growth and potentially to do with puberty. So what I was going to touch on in my talk was a bit about the variation that happens during growth for children, talk about the phases of growth, talk about puberty, and those were the main focuses of the talk. And then I'll also touch on obesity and being underweight, but I'm just going to talk about them quite briefly towards the end. So growth is obviously unique to childhood. So gaining height is unique to childhood. And we've got to remember that there's a big variation in what's normal. And so we've got a distribution which fits a Gaussian distribution. So there's a small number and a low percentage of the tallest and the shortest children, and similarly with weight. And then you've got a large bulk of the children who are in the middle. So by definition, we've got half of the children who are below and half of the children above the middle values. And also, just as a reminder, children have only got one chance to grow. So growth happens during childhood, and then children stop growing when their epiphyses fuse. And also, probably quite fortunately, there's only one chance for puberty. But puberty, although it may occur, well, it should occur in most children within a certain band. Sometimes it's early and sometimes it's late, and we'll come on to that. So we know that children grow at their fastest is in infancy. And in the first year of life, children are growing very quickly. And then throughout early childhood, they grow at a fairly steady rate. And certain things may affect that rate of growth. And so for an example, if a child has severe malnutrition, that may affect their growth, and other chronic conditions may affect growth. And then they will have their growth spurt.
Sorry to interrupt you, Jackie. I can't see any of your slides moving. Are you happy with that? Would you like me to screen share mine?
Sorry, no, they should have been right. Okay, can you see them moving forward now?
Unfortunately not, sorry.
Okay.
Would you like me to share my screen?
No, don't worry, let me go back to here again. Let me go. Can you, are they moving forward now?
They are, yes.
Yes. Okay, so we've talked about the fact that there's a big distribution in the height and weight, and we've talked about the fact that we get fast growth in puberty, fast growth in infancy, and then you have a growth spurt between the ages of 12 and for girls, and boys have an average, they have their growth spurt at the age of 14, and growth stops when epiphyses fuse. So here's a chart which just gives an illustration of that. So children are growing very quick. You can see on the chart which has got the girls grow at their fastest when they're around about 12, and boys grow at their fastest when they're around about 14. And this will account for the fact that girls who are in round about year 8 will be shooting up and may often be a bit taller than some of the boys when they're around about 12 years of age. And then boys will still be growing quite steadily when they're about 12 or 13, and they tend to have their growth spurts at about 14. And the reason why boys on the whole are just genetically a bit taller, but the reason why they end up, or men end up being so much taller, is because they have more childhood growth and their growth spurt is late, or later than the girls. So we've got a wide variation of normal. Children tend to follow the same centile that they've started on once they get to be about 2 or 3, and they will tend to stick to that centile for their height. But they're much more likely to move up and across centiles and move upwards if they are going to become overweight, and then they move across the centiles for the weight rather than height. The height of their parents is relevant in their final height, and ethnicity is also relevant. So I often think that there'll be maybe certain times when people or parents become more conscious of issues with their children's height, and sometimes it's after the school plays or big events, and then sometimes it's on the sports pitches that issues with height and weight become more apparent. So just from the point of view in schools, if you've got the smallest children, they may need adaptations in school, they may be treated differently by their peers, and taller children are often feel quite self-conscious. And of course, obese may be self-conscious, but also it's just worthwhile noting that children who are obese, that's often associated with tall stature. When children go into puberty, obviously these things become more noticeable. They may develop body odour, acne, secondary sexual characteristics, and they may, clearly girls start their periods. And for both sexes, but probably particularly girls, there's emotional lability. So another practical issue in school for obesity, there may be issues about children participating in certain activities. Some of them find it harder if they're heavier to participate in sports. They may get problems with their limbs and joints. But it's also worthwhile knowing if a child is severely obese, they may have obstructive sleep apnea. That may be associated with poor concentration, school performance. And later on in life, they may be at risk of type 2 diabetes, and indeed some children are at risk of type 2 diabetes and increased risks of certain types of cancers. And clearly, if you're for children who are overweight, they may have psychological issues, and also for children who are underweight. Children who are underweight, and we may have issues with hunger, obviously at school, and for children who have got suffering with eating disorders, they may have intrusive thoughts and obsessive thoughts to do with eating, and that may interfere with their school performance. Children may also be struggle to concentrate and just generally have low mood. So I'm just going to talk a little bit more about focusing on girls and some important points to do with puberty. So on average, girls start puberty when they're roughly about 10 in Europe. And the way they start puberty with is they develop breast buds, and then they develop changes in their secondary sexual characteristics. Puberty should happen in a steady sequence. So they may start to get breast development, and around about this time they start to get hair, auxiliary hair and pubic hair. And by the time they actually start their periods, they are well established in puberty and they've got developed breast tissue. So it's just to emphasize here that actually starting periods is a late part of puberty in girls. And starting the periods is not the start. When they start menarche, when menarche occurs, which is the onset of periods, that is not the start of puberty. The interval between the breast development stage to actually starting their periods is roughly about 2 to 4 years. Starting puberty under the age of 8 could be precocious puberty and could be abnormal. So if girls start to develop breast tissue under the age of 8, that could be abnormal. And starting periods under the age of 9, again, could be abnormal. So if somebody refers a child, and a GP refers a child to me and say they've started their periods at 9, that is abnormal, and I would always see those children. And if they've started to get breast development under the age of 8, that is not normal, and I would see them at the hospital. It's also unusual not to have started puberty by the age of 13 in a girl. So having no signs of any breast development by the age of 13 is unusual, but it is not unusual to have not started your periods by the age of 13. So that may well happen. Girls often start their periods when they're older than 13. Now, I'm just going to put this down as being a couple of caveats. It can be difficult to distinguish breast tissue versus adiposity. So, and we're certainly not expecting teachers to be judging whether girls in primary school have got breast tissue or not. And it's not unusual sometimes, particularly if girls look a bit chubby, for them to have the appearance of having some breast tissue. And I do notice that a lot of girls in primary school are wearing little crop tops, various different ages. But actually true breast tissue and palpable breast buds shouldn't really be happening under the age of 8. Now, some girls, and occasionally they may have a little bit of breast budding, which is just on its own, and that's called thelarchy. Okay, sometimes that doesn't go on and progress to full puberty, but again, some of them may be referred up to be assessed. And I'll also mention that we do see a group of girls and sometimes boys who experience physiological release of androgens. So they may develop some body odour and occasionally a bit of pubic and axillary hair, and that can be physiological. So again, if you happen to notice sometimes some of the girls in primary school may have got a bit of body odour, then that isn't necessarily onset of puberty. Just give you a couple of examples of the sorts of cases who may get referred. So a 7-year-old girl with some breast buds, and she seems to have been growing quite quickly. And these children can being a bit moody and what can be described as having a bit of attitude. So this young girl, when she was referred, and as I say, it's a fictional name, mum said she was behaving like a teenager. Tests carried out at the hospital confirmed early onset of puberty, and most situations this is idiopathic, and our job at the hospital is to exclude other causes. Rarely it can be associated with underlying medical conditions, but you can treat this and slow progress of puberty. And when this girl was treated, her mother said that it seemed like she'd got her little girl back. And the main thing would be is that she's much less moody and she's less likely to progress to have early onset of her periods. So another situation and another scenario would be a 9-year-old girl who's referred by her GP because she's already started her periods. Now, by the time she came and walked in to see me in the consultation room, even without actually fully assessing her, I could tell that she seemed much more mature than a normal 9-year-old, and she was tall and she looked much more as if she could have been about 12. So she started to get changes of puberty when she was 7. And because she was referred at the time when she was mature and her periods had already started, there were few options for treatment, and she was likely to be short at her final height because puberty had progressed quickly. And I just sort of mention here, just occasionally, it might be something that comes up in schools, is that occasionally I've seen this with asylum seekers, where children may be said to be younger than they actually are, and then so they might be in a certain year group in their class, whereas actually they could be older chronologically if we actually can identify what their definite ages are. Just for some other further information, about 1 in 10 girls will start their periods in year 6. So primary schools need to be prepared for that. And I know primary schools are, but just that is not that unusual. One in 10 girls will start periods in year 6. And they may have started to have some of the changes in puberty within the preceding year, 2 or 3 years. So just to touch on the fact that problems with periods are clearly common, and a lot of girls in the first 2 or 3 years of starting their periods will have irregular menstrual cycles, and some of them can be really quite prolonged. So if that does happen, and it seems like girls maybe are complaining frequently about having periods, that can happen. It can lead to school absence. If they have prolonged periods and problems, they may have anemia, and occasionally there might be an underlying blood clotting problem. So this can be quite a struggle for some girls because of pain and discomfort, and sometimes they may be helped by going on hormonal preparations. And there's also some terminology which is now used, and I think I'd have said probably previously, perhaps mainly third world issues, people talking about period poverty, where girls haven't got enough money or can't or their families are not financing, they're not able to actually afford sanitary products. So that means that they struggle to go to school. But also it's just in any schools, even in the UK, there was one study showing that on average, in this one study, girls were missing between 1 and 3 days a term because of their periods. And that's obviously that presents difficulties. So not starting your periods by the age of 14 is unusual in girls. And if they haven't started, no signs of puberty by 14 and no periods by 16 is unusual. And occasionally that can be because of a medical problem, but also because of eating disorders. Just going on to boys, and this is just a reminder that I think sometimes people think boys start going into puberty when their voice breaks and use that as a marker for whether they're in puberty or not. But actually, boys starting to go into puberty is with changes in their genitalia, and that happens at an average age of 11 and a half. And they may get gradual changes in axillary and pubic hair. It's very variable when their voice actually breaks, but sometimes that's the thing they feel most sensitive about. And they don't think that they're going into puberty, even though they are getting changes down below. And the growth spurt in boys is quite late in the process of puberty. So starting puberty under the age of 9 in a boy is unusual. And actually, it's really quite rare. And if boys do start to get pubertal changes under the age of 9, there's a much higher chance we might find an underlying problem. So we would definitely be wanting to see those boys at the hospital. But again, it's another caveat. Sometimes boys can get some of these issues with body odour and a bit of body hair with physiological androgen release. If boys haven't started puberty by the age of 14, that is unusual. Sorry, if they haven't started by 14, that is late onset of puberty, but it isn't actually that unusual. Mostly if boys are late going into puberty, it's idiopathic. So in converse to boys who, if they start late, it's idiopathic, but it causes quite a problem for them. So this might be a boy in year 10 who looks like he's in year 7. And about 2 or 3% of boys are not in puberty by the age of 14. So here's an example, and again, this is a fictional case, a boy who was referred at the age of 12. He was very good at football. He used to play for a local side. He didn't feel like playing anymore. He'd become withdrawn. When he came up to hospital, he told me he'd just gone off football. But actually, it's because he was feeling very self-conscious about his size. And for boys who have late onset of puberty, we can give some treatment to boost progress through puberty, a short course of testosterone. So we exclude other causes, and we can offer treatment for it. And we still have to think about eating disorders in boys as a cause of delayed onset of puberty, as a potential problem. And then just briefly, I'll just mention about weight issues. So obesity can definitely cause problems, as you know. It's really, I would say, a public health issue. There are implications at school, but really for you to be aware of the fact that it's very rarely an underlying medical cause. So sometimes people think it's to do with, or it's likely to be due with hormones, but actually that's quite unusual. So up to 15% of children between the ages of 10 years and 17 years are obese, so a high proportion, relatively speaking. And behaviour interventions are introduced, and we've got various ones that we can be put on offer in Suffolk, and various ones have been researched. Some of them may offer some short-term benefit, but unfortunately it isn't often sustained. And these are sort of important points just to take on board. And I think carers, so parents and carers of young people, often overestimate the quantities of food that their children need at any particular age, and it can happen through primary school and into high school. It's quite interesting that a number of parents don't actually recognise that their child is overweight or obese, and the different strategies which are on offer are often trying to motivate the whole family in engaging with a new approach. But actually, to complete some of the programmes, it's quite variable. So I will refer young people to One Life Suffolk and to other services, and it's quite variable as to whether or not they'll engage with it, and certainly whether they'll complete them. We know that teenagers with obesity have a very high chance of progressing to be obese adults, and unfortunately if you've got two obese parents, that markedly increases the probability of obesity in adulthood. Finally, just to briefly mention young people being underweight, and this is particularly in girls, but it can occur in boys, as you know, as well. There are a number of young people who have eating disorders, and some of these are referred to us at the hospital. Mainly they will go to the eating disorders team, but sometimes they're admitted onto the ward, and then sometimes we see them for other issues. So in summary, and apologies for my delayed start, I had some problems with the technology. I'm sure that's another epidemic of this age, at this time, with things going on electronically. I hope I've given you an oversight about what normal growth is, and a reminder that puberty happens in girls when they start to develop breast tissue. Puberty should progress in a steady manner, and it will be often at least 2 to 3 years in between starting to develop breast tissue and then starting periods. Girls tend to have their growth spurt fairly early on in puberty, and that's why they tend to be a bit taller than the boys, around about year 8. For girls, having no signs of puberty by the time they are 13 is unusual. For boys, they would tend to start their puberty when they're about 11 or 12, and they start with puberty with some changes in their genitalia, and then those changes gradually progress and they develop further secondary sexual characteristics, and they have their growth spurt quite late. It's quite unusual to have early onset of puberty in a boy, but we do see some boys who are concerned because they've had late onset of puberty. We see more boys with that problem. Having problems with puberty and feeling as though things are happening too early can cause issues because they're not prepared psychologically to have these changes in primary school, and certainly having them too late can affect young people as well. Can have a fair number of girls who may be having issues with their periods, which can affect attendance at school, and obviously difficulties with them and concentrating if they're concerned about managing their periods. We have got medical treatments can help with a number of these areas. And finally, I'll just touch briefly on obesity and children and young people who might be underweight. Thank you very much.
Many thanks, Jackie. What I failed to tell you at the beginning was that we have got a chat bar, and if anyone wanted to ask some questions, to type in their questions as we were going through your very informative talk, Jackie. I do wonder if anyone does want to ask a question, if you would be happy to take some questions from the floor, if anyone wants to ask any. Is that okay, Jackie?
Yes, absolutely fine. Yeah, that's fine.
So I'll just give a minute if anyone wants to ask a question.
Okay, if anybody has got any queries that they would like to pass on to Kate later, and I'll be more than happy to convey them to any answers to Kate. Okay, shall I?
Okay, thank you, Jackie. Yes, if you'd like to stop sharing your screen now.
Yeah.
So if anyone is wondering who Kate is, it's me, Kate Kingsford-Beer. I'm the lead teacher here at Ipswich Hospital. I work in the schoolroom and I work